Hello, my name is Michael Daly, and I'm going to be discussing with you about the ethical concerns of physician-assisted suicide. What is physician-assisted suicide? This means that a prescription of lethal substance by a physician to someone who intentionally wants to terminate his or her life and voluntarily self-administers the drug. Another form of knowing of physician-assisted suicide is PAS. We will be discussing the different aspects of physician-assisted suicide and the role physicians have taken over its time. The problem of whether physicians should help end the suffering of the severely ill patients has been argued since antiquity. Evidence shows that some secretly practice PAS even though it is prohibited. In the 1990s, this was flaunted when Jack Kevorkian aided in a 150 patient death. Although the idea of PAS is not completely rejected in the United States, it is still not enough in favor to legalize the act of PAS in the country. The public is still divided of whether to legally allow this. Around 2/3 of the people in the United States approve of PAS as an option for patients who are terminally ill with uncontrollable suffering. However, only half of the same population are in favor of its legalization, reflecting the inherent of uncertainties of the issue. The ethical controversy, even in efforts to support PAS, some points have been made about patients' quality of life. Some may think that they can benefit from dying or not even having ethically significant difference with withholding life support. Ultimately, the goal is to respect the patient's values and provide comfort during the time of suffering. Some more arguments supporting PAS. Intentional death causation is sometimes considered morally acceptable. It reduces suffering that the patient is experiencing and not considered as the patient's death is certain. So we've talked about the supportive arguments. Now here are some opposing PAS. The intention of death and the dying benefits are still not known, although we may never know. PAS and life support therapy withdrawals are distinct. Withdrawal of life support goals, such as removal of burdensome treatments and comfort, are realized regardless of whether patient dies. PAS goals are only attained through a patient's death. However, still humans have an intrinsic value that surpasses preferences and circumstances when it comes to intentional causing of death, still morally unacceptable. My current position on PAS. Personally, I'm against PAS due to the following reasons. I work in healthcare. It has taught me that PAS is morally a disrespect of life. There are many factors that can sway the outcome of PAS, such as help from palliative care and a recovery due to a misdiagnosis. Seen plenty of hospital patients be misdiagnosed, whether it be an orthopedic diagnosis or a life-threatening diagnosis. Mistakes happen, human error happens. That's why everybody gets a second and third opinion when it comes to these things, especially when it comes to death and life and death. Future considerations, discussion of all legitimate choices in treatment of suffering, such as palliative management and prescriptions of medications for managing pain or other symptoms, recognition of difference between hindering the intervention access of patients and restricting their own actions. Patients should be restricted to follow their own choices or not being pressured by family. Take palliative care definitely should be discussed in details with the patient if cognitive. The impacts in healthcare. Healthcare professionals are aware of the suffering patients experience, and although the majority approve of PAS to be legally, many healthcare-related associations like the American Medical Associations disagree. They believe physicians must have a hard response when it comes to patients wanting to end their life. Another association, the American College of Physicians, is also against the legalization of PAS due to its serious ethical concerns. So current policies. One of the current policies is death with dignity laws, which is an aid in dying laws or physician-assisted dying laws. This is basically for patients terminally ill, and not the government, politicians, nor religious leaders should decide for their life and determine the amount of suffering they must endure. It permits mentally competent adult state residents with terminal illnesses whose prognosis to live is confirmed to be at least 6 months to voluntarily ask for and receive medication prescribed to hasten their death. The voluntary option gives patients control, dignity, and peace of mind on their remaining days with their families. Statutes ensure that their driving force of the matter is still within the patient and not the physician. As I mentioned earlier, throughout this presentation, the United States as an entirety has not approved of physician-assisted suicide. However, 8 states have death with dignity laws. Those 8 states are Washington in 2008, Death with Dignity Act; Maine, Death with Dignity Act in 2019; New Jersey, 2019, Aid in Dying for the Terminally Ill Act; Hawaii, Our Care, Our Choice Act, 2018 and 2019; District of Columbia, Death with Dignity Act in 2016; Colorado, End of Life Options Act, 2016; California, End of Life Option Act, approved in 2015 and in effect of 2016; Vermont, Patient Choice and Control at the End of Life Act in 2013; and Oregon, the oldest state to bring this in, was Death with Dignity Act in 1994, effective as of 1997. As I finish this presentation, although PAS may not be legalized soon, we must always remember the main priority in healthcare is always the patient, as said by Edmund Pellegrino, 1994.